This is why, it's rainy season now. You see the pattern of cholera. It first starts from the southern states because that's where the rainfall starts earlier before it comes to the northern states. These are the things we are tracking again. That's, in essence, we're working together with the weather, NIMET and all those people. Cholera remains endemic in Nigeria, particularly in communities with limited access to clean water and sanitation. It is a highly contagious infection caused by a bacterium called the Vibrio cholerae and can be fatal without prompt and adequate treatment. As we approach the peak of the rainy season, a concerning trend in cholera transmission is emerging. During the presentation of the 2025 Annual Flood Outlook, the federal government issued a warning to 30 states and the Federal Capital Territory about imminent flood risks. Notably, this year's outlook introduced a community-based forecasting approach designed to enhance preparedness and early response efforts across vulnerable regions. According to the forecast, 1,200 communities in 176 local government areas have been identified as high flood risk zones, and an additional 2,187 communities in 293 local government areas are classified as being at moderate risk of flooding. When you have rains, you have the potential for flood, especially in those areas where physical planning is not optimal, where they don't have physical planning at all. And once you have flood, those ones have their consequences. We'll come to that later. This proactive dissemination of localized flood risk data is expected to drive coordinated action at the federal, state, and community levels, ensuring timely interventions that can help prevent waterborne disease outbreaks like cholera. NCDC is actively tracking these occurrences. As at the epidemiological week 16, that is that week ending April 20th, 1,307 suspected cases of cholera have been reported across 30 states and 98 local government areas, with 34 associated deaths. If you collect, cholera is all year round in this country, but gets especially increased during the rainy season for obvious reasons. We now have a case fatality rate of 2.6%. This rate again is well above our targets of less than 1%. And that's why again we need to come out early now and start working with the states. About cholera. Cholera is a food and waterborne disease caused by the ingestion of this organism in contaminated water and food. Water is usually contaminated by the feces of infected individuals. Contamination of drinking water can occur at the source, during transportation, or during storage at home. Food may be contaminated by soiled hands, either during preparation or while eating. Beverages prepared with contaminated water and sold by street vendors, especially contaminated ice, or even commercial bottled water, have been implicated as vehicles of transmission, as have cooked vegetables and fruits freshened with untreated wastewater. In some cases, these people prepare vegetables and all, they say wash. What they used to wash are not good water, not treated water. The time between infection and appearance of symptoms, this is what we call incubation period, is 2 hours to 5 days. It has a higher risk of transmission in areas that lack adequate sanitation facilities and or a regular supply of clean water. Unsafe practices such as improper disposal of refuse and open defecation endanger the safety of water used for drinking and personal use. People most at risk are people of all ages living in places with limited access to clean water, the people living in areas with poor sanitation and poor hygiene, people living in urban slums where basic water and sanitation infrastructure is missing, people living in rural areas who depend on surface water or on unsafe or borehole well water sources for drinking, people who consume potentially contaminated food or fruits without washing and cooking properly, and people who do not perform hand hygiene at appropriate times. Man-made or natural disasters like flood, resulting in population movements and overcrowded refugee camps, cholera situations occur frequently there. The relatives who care for sick people with cholera at home, healthcare workers including doctors, nurses, laboratory scientists, etc., and other health workers who provide direct patient care in the absence of standard precautions. What are the symptoms of cholera? These include the acute, profuse, painful, watery diarrhea, which we normally describe as characteristic rice water stool. The kind of stool, if you look at the stool they release, it looks like rice water. When you are boiling rice and you sieve the water, that's what it looks like. Several cases can lead to death within hours due to dehydration. That's what kills in cholera. These people lose a lot of fluids all within a short time and they go into shock. That's massive blood fluid loss. However, most infected people, about 80%, may only show mild symptoms or have no symptoms at all. Cholera treatment. This disease is easily treatable if detected early. Most infected people can be treated successfully through prompt administration of oral rehydration solutions to replace lost fluids and electrolytes, and occasionally appropriate antibiotics. The oral solution is a powder that can be reconstituted in boiled or bottled water. Cholera can be deadly when infected people do not have access to care immediately. Cholera can be prevented through ensuring access to safe, potable drinking water, proper sanitation and waste disposal, appropriate hand hygiene including hand washing. Raw fruits and vegetables or food from street vendors and raw or undercooked seafood should be avoided. Our advice to the public: to reduce the risk of cholera, the NCDC offers the following advice. And I want to implore you, these are the messages we need to get across to the people. As government is doing their own, whether federal or state, the people themselves must adhere to this. One, they should ensure that water is boiled and stored in a clean and covered container before drinking. Practice good personal hand hygiene by washing your hands frequently with soap under clean running water, or use alcohol-based hand sanitizers if soap and clean water are not available. Ensure that food is well cooked before consumption. Only consume raw food such as fruits and vegetables after washing thoroughly with safe water. After cooking, food or boiling water protect against contamination of flies and unsanitary handling. Leftover food should be thoroughly reheated before ingestion. Persons with diarrhea should not prepare or serve food or hot water for others. Avoid open defecation, indiscriminate refuse dumping. Ensure proper disposal of waste and frequent clearing of sewage. If you or anyone you know experience sudden watery diarrhea, please do not self-medicate. Visit a healthcare facility immediately. We also give advice to health workers, because health workers play a vital role in detecting and managing cholera cases. We urge all healthcare professionals to: 1. Adhere strictly to the infection prevention and control protocols, including the use of personal protective equipment as needed. Promptly report suspected cases to the disease surveillance and notification officers, or DSNOs, in your state or local government areas. Educate patients and community members about preventive practices, and refer patients with symptoms promptly to designated treatment centers. Healthcare workers are also advised to always practice safety precautions, like I said earlier, and they should intensify surveillance efforts to promptly report suspected cholera cases. We also want to make specifically to advice to the state governments. We will also write to them again directly. NCDC continues to advocate to state government to prioritize action for solutions that ensure access to and use of safe water, basic sanitation, and proper hygiene practices in communities. Specifically, we advise the activation of their emergency preparedness plans to address enhanced surveillance efforts, potential flooding and displacement events, mosquito control efforts, that is elimination of breeding sites, and establishment of cholera treatment centers or ORT centers. While we mention mosquito, during rainy season or flooding areas, apart from increase in diarrhea cases, especially cholera, we also see increases in malaria, yellow fever, and dengue fever. Why? Because mosquitoes who carry this disease breed inside water. When you have rain, you have water accumulating in some vesicles around the homes, or in gutters or drainage systems that are not draining. If you look at those drainage systems, you see mosquito larvae. That's during the drainage, their numbers are increased. And once they increase, the chances are that they bite more people. Malaria, yellow fever, and dengue fever can increase. That's why, again, these are also diseases linked to rainy season or flood. So we advise state governments again to urgently constitute their rapid response teams. Consider vaccination campaigns, especially those diseases that are vaccine preventable, like yellow fever. Check sewage and drainage systems. The reason why we're saying this is that when it rains, runoff water, surface runoff water goes into this drainage system and sewage system. If they don't drain anywhere, they mix with all these feces of water that the people defecated, and that's where again these cholera cases increase, especially in those slum areas where you have proper water supply. And we urge again state government again in preparedness to provide provision of water like water tankers, treatment of rehabilitation of boreholes, and provide emergency toilets or latrines where necessary. These are things that state government must prepare for some of these, especially as the rains are here. We also appeal to states to avoid suppressing information. Please send in your line list of cases in a timely manner. If you remember the last episode, a lot of states were covering up data or information. Probably they felt it's a stigma for them to report cases of cholera, but they are doing a disservice to their people. Because if they suppress information, these diseases spread. So you have more deaths. So when they have cases, they should let us know so that we can mount adequate response. To ensure readiness and early control, we in NCDC we have implemented these preparedness measures. We've conducted cholera readiness workshops in the southwest and northwest to enhance preparedness and response capacities, and similar ones are being planned for the south-south, northeast, and north-central zones in May. Treatment protocols have been disseminated to all states. We have pre-positioned response commodities, cholera test kits, IV fluids, all the things we feel they will need to start their response plans with appropriate training. 134 local government areas have been classified as hotspots and have been prioritized for multi-sectoral intervention, including potential rapid response deployment when the need arises. These communication materials reviewed and updated, and the hearings, I think the hearings have commenced now. We're going to send copies again to the states for them to reproduce at the states. We conduct weekly surveillance updates and disseminate this to relevant authorities and stakeholders. Technical support to surveillance officers are being provided to support data harmonization efforts. The 36+1 states currently being assessed, all the states are being assessed for their readiness to cholera outbreaks. I think we're about concluding and are coming up with our outlook, just to measure that which states are ready, which states are not ready, so that we can support those that are not ready. Interaction review on cholera response will be carried out as at when due. In closing, while new cholera cases remain relatively low, their spread across 30 states amid the rainy season underscores the need for sustained vigilance. We call for intensified multi-sectoral collaboration, especially in water, sanitation, and hygiene to prevent further transmission and reduce mortality. Though recent declines in Lassa fever and meningitis offer hope, the rising risk of cholera demands renewed alertness. We urge all Nigerians, citizens, and health workers and partners to stay vigilant, act early, and follow preventive guidance. In NCDC, we remain committed to leading a coordinated national response, working closely with state governments and partners to ensure timely support and regular updates.